Oral maxillofacial surgery is one of the most popular residencies for dentists. It is a mix between medicine and dentistry, but also is now becoming very popular as it relates to other things around the head and neck. Hair transplants, nose reconstructions, cosmetology, so many different things that are not part of the traditional mix that we're going to be talking about, and how you survive as a resident in oral surgery. Stay tuned. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school and surviving dental school, but also getting into residency and surviving residency, and then life as a new dentist. Guys, if you're enjoying these videos and you're getting some value, please hit the like, but also share. Sharing is caring, especially when we're trying to help as many new dentists as possible with information about dental school and about residency and life as a residence after residency as well. But also, this episode is being brought to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com, with 3 tools and 3 ways that Dr. Darwin, me, can help you get into residency, not now, but right now. Go over to the website and check out some more information. And here it is down below, GetIntoDentalResidency.com. So today we're joined with one of my colleagues that I met. Oh my God, it's been probably 5 years ago when he was a dental student.
I think about 5 or 6 years now.
5 or 6 years ago when he was a dental school student, when he was applying into oral surgery, and now he is the chief resident of oral surgery at Howard University. Welcome to the show, Dr. Nnamdi. How you doing, man?
Thank you very much. Thank you. Good to have you on this. So good to have me on this platform. I know we've been trying to meet for some time, but due to the busy schedule of life and every other commitments we have, and it's been challenging. But I'm very grateful to be here today. Let's roll. Let's talk about anything you want to talk about.
Let's get it. Well, first, please introduce yourself. Tell everybody who's maybe meeting you for the first time a little bit of about yourself, where you're from, and anything else. So go.
Okay. I'm going to introduce myself to everyone. Hi, all over the world, wherever you guys are listening from. My name is Dr. Anosike Nnamdi. I don't think this might be the first time you all have met me, because I have received email, courtesy Dr. Darwin, from my previous interviews from all over the world. I've received email from people from India, Pakistan, Russia, Australia, Argentina.
Wow.
All over the world, Nigeria, South Africa. I actually have a special folder for emails that are like consequence of interview from Dr. Darwin. So for those people that haven't met me or haven't spoken to me, my name is Anosike Nnamdi. I'm an oral and maxillofacial surgery resident, actually one of the chief residents at Howard University Hospital, oral and maxillofacial surgery. A little bit about myself. I originated from Nigeria, but I consider myself a proud American. I'm currently in the United States military, and that's much about me. Like, that's all about me. You could ask any questions at any time. Reach out to me. Dr. Darwin is, it's a very good source of information, and I'm very grateful that he's invited me to this interview today.
Yeah, man. Well, you've earned it with all the hard work that you've put in.
Thank you.
And you've continued that line of success as an oral surgery resident. So let's dive in, man. So why oral surgery? Why did you decide to do oral surgery?
Why did I decide to do oral surgery? I don't think my reason has changed from the last 2 interviews I had with you. I wanted to do oral surgery because, one, I wanted to be a surgeon. What kind of surgeon it was, I wasn't sure. As young as when I was like 5, 6 years old, I always wanted to be a surgeon. I would be out there on the streets, playing with kids on the streets, and a kid gets injured and other kids would run away. I was the only kid that stayed back and was like, okay, let me help you out. And I was never scared of wounds, never scared of bleeding, never scared of like seeing deformities or anything like that growing up as a kid. And I was always fascinated about how the body works. I looked at it from a perspective like, how can you manually fix the body. So why oral and maxillofacial surgery? I got into dental school and I discovered that there was actually a part of dentistry that was more like surgery for the head, for the face, the head, neck, and everything. I was like, that's the right place to be. The intricacies, the complexities of the face, of the head was just what needed to blow my mind off. And that's how I got into oral surgery.
Awesome. So I know you guys can check a couple of these other videos. Actually, it's right up here. Check this other videos with Dr. Anosike, and that will kind of give you a background of how he got to where he's at right now. But also for those that are applying to residency right now, and also even starting, because the residency start cycle just started maybe about 30 days ago as well. So check out that video and you'll find out some more information as well. But let's talk about what a typical week is like, because for those that are trying to get into programs, but also trying to survive, and you've been able to do this for the last 3 years, going on to your 4th year now, what is a typical week like for an oral surgery resident?
What's a typical week like? That's a very good question, because you need to know what you're getting yourself into. I tell people, don't walk blind into anything, especially oral surgery. That's the least thing you want to walk into. For most programs, not just my program, most programs, your typical week, let's say a week starts with Monday, because actually in the true world of oral surgery, there's never a start date. It's never a break date. There's never really like a Monday to Friday. It's not a Monday to Friday thing. It's the rest of your life. So let's say we want to start our week on a Monday. So Monday rounds in the morning as early as 6:30 in the morning, but it actually depends on the workload you have. There are situations in which your rounds could start as early as 5:30 to 6. So it's all at the discretion of your chief resident, who has to coordinate with the program director. So a typical week starts your rounds. If you have cases scheduled for that morning, then you get your morning huddle. You kind of assign the days, jobs, and the whole week's workload out to different members of the team. So for the interns, you are the workhorse of that program. The interns are the workhorse, while the chief residents will be the brain of the program. They will be the actual, the guys that try to run and organize the program. But the interns, you are the workhorse of that program. So for those coming in, you're going to be an intern. So what would your day feel like?
So clarification, Doc, when you say interns, do you mean the 1st, 2nd, and 3rd year residents as quote unquote interns, or other non-residents that are interning, because some programs have an intern? Okay.
No, so I mean the first years in particular, but that doesn't exclude the 2nd years or the 3rd years, but most times the 1st years, because as you know, in oral surgery residency program, you have offsite rotations. So at the end of the day, most of your 2nd years and your 3rd years will be on offsite rotations at every given time. But the 1st years will always be in-house for the most part of your program. You might do some offsite rotation as a 1st year, but most times the 1st years will be in-house. So that terminology intern is actually for residents, either non-categorical residents or categorical residents, but it's for 1st year residents, drags a bit to 2nd year residents, and then a little bit to 3rd year residents. So what your day is like, you after your morning huddles, if you are assigned to scrubbing or assisting an OR case in the morning, or if you have to run clinic. Now for my program puts a lot of emphasis on not just clinical aspect, but also developing the residents in terms of academic development and research development. So we'll have a lot of didactic sessions in the morning up to about 9 a.m. That's excluding emergencies that come into the clinic or you get paged to the emergency room, but we have didactic sessions. We'll talk about researches, we'll talk about scheduled lecture topics that kind of build that intern into the right oral surgeon, so that you know what you're doing, you have the academic knowledge of properly implementing your clinical skills. Then you go into the clinic. So most of our cases we see in clinics are dental and pathology, based on the environments where we find ourselves in Washington, D.C. You do a lot of dental cases, from simple to complex exodontials, that's extractions, from get-go, we want our junior residents to get involved in surgical extractions. There's no limitations to what you do as much as possible. If you're ready for it, we try to encourage you. We teach you how to do that. And if you're on call, you also have to take calls at the same time. So your pagers will be going off. You would have to try to hurry up your procedures, go make that call, see whichever team is consulting you wants from you. That would be like by the hours, and we try to encourage our residents to take like lunch break. Sometimes you could actually go a whole day without like taking any break. It's unfortunate, but
Oh, wow.
we try to encourage. Yeah, so like personally, I go around asking all the residents, like, make sure you get some break, make sure you get some break, because there are situations in which you get carried away or consumed by the volume of work that needs to be done. We do a lot of pathology cases.
So are you guys taking emergencies all throughout the day?
Yes.
Or just
yes, we're taking both walk-in emergencies into the clinic. We're also taking emergencies that come into the emergency room. We also take consults from other departments in the hospital. You will be surprised how much consults in a day comes in. You could get like from the emergency room, the average, now it's summertime, the trauma cases are picking up. An average of about, I was just speaking to one of the residents who was like, they got about in a day, about 15 pages. And 15 pages, you might sound like 15, but one page could take about 30 minutes to 40 minutes, or sometimes an hour or 2 hours to resolve. Yeah, so your typical day looks like that. Then we try to encourage relative work-life balance. So we discuss things as we go along the process of the day. There are times where we ask each other questions. We're like, okay, go look this up and things like that. But a typical week would not just be like your day. It also includes taking calls at night. So you could, if you are the first intern to take calls for, let's say, on a Monday, so that means you would have to we do in-house calls in my program and in most programs I know of. So you'd have to not go home, and this you'll be prepared for because you would have known your schedule at least 15 days to 1 month in advance. So you would have to stay back in the hospital, cover all the new cases that come into the emergency room that is related to oral surgery, as well as the in-house patients. Now, how this is done, you have to communicate, be in constant communication with the rest of the team, especially your backup. Never be shy to ask questions. Then the next day in the morning, you would have to present all the consults you had in the emergency room, and as well as presenting the in-house cases. Sometimes you would actually have the opportunity as an intern to scrub into some cases and participate in those cases with the rest of the team. Now, for the rest of your year in the program, because I know I've been talking about interns a lot, but for the rest of your year in the program, for the rest of your duration in the oral surgery program, you would be opportune to take rotations in other programs, in other residency programs in the hospital, such as trauma, where you be the primary person on call for trauma team. Sometimes you might be surprised that you might, as an oral maxillofacial surgery resident, you are the first person running to the emergency room when that trauma call comes in. And you're not going to give excuses of, oh, I'm just an oral surgery resident. I have been opportune, and I'm so grateful that we get that kind of exposure to put in chest tubes, chest drain, decompressions of pneumothorax, handle gunshot cases, and things like that. Also, emergency medicine rotations to in surgical intensive care unit rotation. So all this will package medicine, internal medicine rotations, but at the same time, you won't forget that you are still a dental resident. And what does that mean? During the course of your residency program, you will have lectures in dental school, lectures with different other postgraduate dental programs, such as oral pathology lecture, lectures with orthodontic residency programs. You talk about cephalometric, because we need that for oral surgery, like in terms of orthodontic cases. You would also do other lecture programs or other lecture classes with the dental postgraduate residencies. So this is just a very brief summary of what it's like. It's packed, it's exciting, and it's exhausting.
So that means you have coffee, you have an IV drip of coffee, and you got roller skates on. That's what That's what the new age oral surgery residents have now.
Yeah, you will need that. So in your clinical coat pockets, you would have sutures, tongue depressors, but you'd also have snacks. You will find that snacks in your like that. That will be your mainstay because you're always on the move.
You guys
have snacks. Yeah.
You guys heard it. You gotta have snacks.
You would know where all
you got sutures.
You know where all the vending machines.
Right.
Yeah.
Suture in one pocket, and you got snacks in the other pocket. You gotta have it. There you go.
Yeah, you know where all the vending machines are in the hospital. Gotcha. You know because that just the vending machines might be your pit stop because you don't have enough time to go eat something.
So what about Saturdays? We kind of talked a little bit about what the week. It sounds like the week really extends into Saturday and maybe even on Sunday, right?
I don't think that, as I said initially, I don't think there's a break. Especially for I don't think there's a break, especially for the beginners. There really wouldn't be a break. So make up your mind that Saturdays and Sundays are work days. Tell your family, tell your significant other, tell your friends. Your Saturday and your Sundays are also considered a work day.
Work day.
If you find yourself in a program that you're on Q2 call, which means you're on call every other day, invariably you're going to be on call on Saturday or Sunday. So you will work every day. So there's no break.
Now with there being multiple residents, not only throughout the program, but also within the years, do the residents work as a team when they're on call? Meaning if there's 4 residents in the D1, in the oral surgery 1 slot, do
PGY1.
Yeah, PGY1. Do 2 of them work on call together, or is it just, every other day there's some, one person, PGA 1, the first person on Monday, second person on Tuesday, third person on Wednesday, or do 2 of the people take call together at night? Like how does that work?
Okay, so how this goes is for the first month of your program, it cuts across most programs in the country, I think. So for the first month, your July, welcome month July as a first year as a PGY1 resident, you will be on backup call or body call. Body call, what does that mean? So while you're on call, we're not going to put 2 first years together. It's like it's of no benefit having 2 first years together. So what a body call is you'll be on call with either a second year, third year, or a fourth year resident. They would guide you, show you, walk you through the ropes and guide you through the whole process. They would teach you the basic things you need to do, teach you everywhere in the hospital how to communicate with the rest of the teams in the hospital, different team members in the hospital. So you get that luxury for your first month of being with someone attached to you.
Okay.
But by your second month, you basically will be yourself, but you would have someone called a backup. And by the second month, your backup would be either a third year or a fourth year resident. Most times a fourth year resident. So what does that mean? Your backup is someone that he's ready to go. You get into the emergency room, you get called and you go into the emergency room, the trauma bay, and you see that case, a fracture of the mandible. Yep. And you kind of you can't handle a fracture of the mandible as a first year all by yourself. So you give him a call, no matter what time of the day is. He's there to, so you could actually call him to come into the hospital.
Okay.
You could tell him, you could say, Dr. Anosike, I have a mandible fracture, fractured in multiple places. I would discuss the X-ray with you, and then you'd be like, I would be, what's your opinion? What's your treatment plan? And most of the time, I would be like, okay, I'm on my way.
Yep. Okay, I got you.
Yeah, so there's always a backup call for you, but your first month, it's a body call. There's someone that will be on call with you. Now, to directly to your question, the first years, after the first month, the first years will be on call by themselves. So the D1, PGY1 residents, resident number 1, 2, 3, we'll take 3 people every year. Resident number 1 will be on call on Monday. Resident number 2 will be on call on Tuesday. Resident number 3 will be on call on Wednesday. Then it resets back to resident number 1. But by the end of your first month, in your second month, most times you will be the only first year on call. You'll be the only first year in service. What does that mean? The other 2 first year residents will be off to other rotations, internal medicine, anesthesia rotation.
Gotcha.
But you have a second-year resident in-house with you, a third-year resident in-house with you.
Gotcha. Okay. So there we go. We talked a little bit about typical week. We talked a little bit about call, how it's you have a buddy system and a backup. Let's now talk a little bit more about parts of the program that you like so far. I mean, you've been there 3 years, and this is you're one of the chief residents in this fourth year. What do you like so far about the program?
About my program, what I like much about my program, I think I love, I think I love trauma cases, one, and next, pathology cases. Pathology cases gives you that vibe of being an investigator. You see this patient on the chair, you do a proper history examination. You don't just jump into the pathology per se. You also have to get a good assessment of this patient medically. Pharmacologically, you want to get a good history, social history, and you look at the lesion, your mind begins to race. What could this be? Could it be a pathology? Could it be a benign case, or could it be a malignant case? What are your options? What kind of investigative techniques or procedures? So, I think I've slowly fallen in love with trauma. And next, pathology cases.
Gotcha.
Yeah, so that kind of guides my way, because I've always wanted to be like, what can I contribute, being not just an oral and maxillofacial surgery resident, but hopefully being an oral surgeon in the U.S. Army. And I know there will be need for trauma.
Yeah, you guys are up there.
For trauma.
You guys are there in the front line. At least the oral surgeons that I knew, that when we were in the Air Force, that were part of the medical group, they're usually part of the front line that's behind the front line, especially for trauma. All right, so we talked about what you like. What about some of the challenges? And give it to us straight, man. What are some of the challenges the challenging parts about the residency?
The challenging part about my residency, I think, is a problem common to most programs in the country. Finance and running of the program, in terms of letting the hospital at large understand the needs of the program. Yeah, letting the hospital understand the needs of the program, letting the hospital understand, we're not just working on teeth alone. So that idea that we only do teeth, and so we don't need much. We only take out teeth. So we're trying to make them understand that manage the whole human being, not just teeth alone. And we need to be in tune with in terms of development, research, and things like that. So the basic funding from the hospital per se to our department. And I have to give props to my program director and chairman, Dr. Dana Jackson. He's been very wonderful. He has been able to navigate that challenging course, and we have gotten so much upgrades within the past almost 2 years has been in the program right now. So I have to take this opportunity to give him a lot of props. His name is Dr. Dana Jackson. That's one huge part that was a very big challenging problem. The second part is management of human resources. Trying to coordinate not just the non-clinical staff, but the other members of staff in the hospital that you have to come across one way or the other. It's been kind of challenging, trying to open channels of communication. Howard University Hospital is a predominantly Black university, and there's this cultural element in Blacks in terms of respect of the older ones, which is normal, which is accepted. But sometimes in the midst of that respect of the older ones, the younger ones are really not given opportunity to express themselves. It's been a huge problem I've seen in Howard University, in which the younger ones are not given opportunity to properly express themselves and contribute towards the development of, that hierarchical system.
The hierarchy.
Hierarchy system of what's your opinion about how to solve this problem? From things that affect our residents, my oral surgery residents, to things like being on call and other challenges to to things like, okay, like how can we make things better? How can things be done differently? So it's always that, oh, I've been in the system for so long, and this is how we do things, and this is how you're going to do things, and not being able to leave an opening for room for negotiations or for say, okay, let's be innovative. So that was one challenge I really noticed in the program, and I was always vocal about it. Yeah, but the rest are other day-to-day activities and day-to-day challenges that comes along the way, and patient management, trying to educate your patients, trying to, like, we find ourselves in a society that we take pride in taking care of the less privileged and the socioeconomically challenged people in our society. And with them, trying to educate and change their mindset towards receiving quality care. When people come to you and or they already have their set opinion, and you try to educate them, sometimes it goes the wrong way. Sometimes they end up being like exchange arguments and things like that. So I usually tell my residents and myself, just take a step back, walk out of the room, let the whole atmosphere calm down before you come in again.
Yeah.
Well, I think those are some of the biggest challenges we have over in Howard University Hospital.
Gotcha. Thanks for sharing that. So this is the part that everyone's been waiting for. And if you guys are listening and watching, thanks for staying all the way through. These are the tips and the advice for future oral surgery residents and future oral surgery candidates, and tips, advice. What do you have for those incoming residents that are getting ready to start the program, and for those current residents that are continuing through oral surgery programs? What do you say to them?
Okay, for the guys that are aspiring oral surgery residents, those interested in oral surgery, first things first, I'll tell you guys, be calm. The process will come by and go past. The mental turmoil that comes with applying for oral surgery, it's overwhelming. It's a lot, but stay calm. Be objective in your approach, in your planning. Planning is key. Communication is key. Find a good resident. Find more than one resident willing to talk to you. Sometimes oral surgery residents might be seen as being brash, arrogant, or things like that. In addition to maybe personal attributes, the stress of being in a residency program could be very, very difficult to have on us. So, but find a good resident in different programs, speak to them, ask questions, find out what each program is all about, find out what kind of residents are they looking for in their program. Be on top of your academics. As a dental student, stay on top of your academics. Be prepared. There's the CBSE exam. The scores are getting a whole lot better, which means the competition is getting harder. So for the CBSE exam, prepare well in advance. It's not something to crash. Understand what you're studying for the CBSE exam. I know COVID has taken a toll on in-person externships. But some programs were running virtual externship programs, which is, it kills the vibe of externship. Externship, you want to be in that program, you want to immerse yourself in that program. So take advantage of any program that still has an in-person externship program. Now, two advice when it comes to externship. Externship is that time in which the current residents and the attendants in that program evaluate you, look at you and see what kind of a resident are you going to be.
Right.
The present residents in the program where you do your in-person externship will watch you. They will give feedbacks to their program director, to their attendants. I've been in situations in which I've been in rotations in other residency programs in which an extern, last day of externship, leaves, and guess what? All the residents sit down and describe everything about that person and give a positive or a negative report to the program director. As soon as you say that goodbye, as soon as you walk out of that room, all the residents come and sit down, and you're the talk of that meeting for the next 30 minutes. And next thing, they give a feedback to their director right there while the memory is still fresh. Now, so what does that mean? Don't be arrogant. I've seen externs who come to residency program with the mindset of wanting to teach the in-house residents, the current residents, how to do things. Don't be arrogant. Yes, I've seen that.
Why? Why would you do that though?
I've seen that. I've seen an extern tell a first year resident, "You don't know what you're doing. Let me teach you." I have seen that, and yes, it happened on a program. I was rotating through another program, and I saw an extern make that statement to one of the interns in that program, and I was like, so attitude it's key.
Yeah.
Show them you want to be a team player. No one expects you to be as knowledgeable as a current resident on oral and maxillofacial, but show them you have interest. Show them you're ready to put that work in. Yep. They ask you a question, you don't know what it is. You get your jotter, get a pen and a jotter everywhere, a little notepad, write down something, go back home. The next day, tell that resident who asked you that question or the group, this is what you read. A little synopsis of that. It shows that you're willing to put that effort.
That's right. And it shows them also that you're teachable.
Yes, you're teachable.
And that you want to learn. And you're there to learn, because if you knew everything, there was no need for you to become an oral surgeon.
Yeah, exactly. Yeah. That's true. So that's my advice. Take your studies seriously. Prepare well for the CBSE exam.
Now that exam, let's go to that real quick, because for oral surgery, that is let's get the elephant out the room. Let's beat up the elephant. That exam is very heavily weighted when it comes to your candidacy. So any tips on how to study for that, and when to study for that, and when to take that? Because
the best time to study for the exam, I wouldn't lie to you, is from your very first day in residence, your first day in dental school. Your very first day in dental school, it's so much, most of the questions in that exam are so much out of the daily dental school learnings that so you need time to kind of understand the science behind the questions to give a good answer. So you basically are taking the same exam as the medical student, the USMLE. It's the same questions. People have said if you study like you're studying for the USMLE, you do well in this exam. So what do you use to prepare USMLE questions, UWOD questions, medical school questions, like the in-service class and exams or tests medical students do, would be a very good guide to prepare for this exam. When do you start? I said from your very first day in dental school. If you're interested in oral surgery, take that time. 1 or 2 pages of those material every day will help you. Repetition, most of these things are repetition. These questions are repeated 1, 2. Learning sticks by repeating, and repeating, especially for the non-traditional students who have other engagements like family and other things, and family and kids and spouse to deal with. So you need more time to focus on preparing for this exam. Just like me, I'm a non-traditional student, a foreign trained dentist and things like that. So you have to work double hard to be at the same level as your colleagues who have no other commitments other than just dental school and life.
So would it be wise to take it, if you know you're applying to oral surgery, you want to become an oral surgeon, you're going to be applying, probably, sometime midway through your 3rd year of dental school. Should candidates take it as early as the end of 2nd year?
Yes.
Or
now,
3rd year?
I think.
Now, is there a time frame for the scores though?
No, there's no time frame for the score to expire. One, and as it is now, there is no limit to the attempts to that exam. But I know things change. Why do I say things change? Because the scores are getting a whole lot better. Applicants are getting better scores. So just like the MBDE and things like that, there might come a time, which I foresee in the not too far future, in which they might limit your attempts at that exam. 1, there might come a time in which they might restructure. They've already restructured the scoring pattern of that exam. So there might be changes. So what I tell people, early preparations, if your dental school gives you the permission, I think some dental schools will give you the permission to go ahead and take the exam or not. Now, if your dental school doesn't give you any permission to take the exam in your second year. Your first attempt at the exam might just be to understand what the exam feels like, what the questions are like. Take the exam in your second year. That might just be a trial run. Take it second year. Towards the end of your third year, towards the end of your second year, beginning of your third year, you should start having those good scores. Start getting your application ready. So at least by the middle of your third year, you should have taken that exam. If you want to match at the end of your fourth year.
And you bring up a good point about, preparation and when to take it and being strategic about it, especially with you having all that information in your head first, second year. And you mentioned good score. What's a good score, do you think?
Depends on the program. Every program
that's a range. Is there a range?
Yeah. So when you talk about range, so you're looking about I think the old scoring pattern, because the scoring patterns changed last year, I think. So for the old scoring pattern, you're looking at about 60 and above. 60 and above gives you a good opportunity. Although I have seen candidates get accepted with as much as 50, 55. Like about 3 years ago, 2 years ago, the ranging score, the median score was about 50 to 55. That was the median score. But I think slowly the peak of that range is moving towards like 60 and 65.
Gotcha.
So, but with people performing so well in that exam now, that there might be changes about limits to how many times you can take the exam. The range of the score, the limits might increase to about 65.
Gotcha.
Yeah, but I just want to reassure everyone applying to oral surgery program. It's not just the score in the exam alone.
Yes, that's true.
Some programs, I know some programs. There's a program I interviewed in, and I was speaking with one of their residents of recent. They have a cutoff mark. If you don't score above, I think 60 or 65, they're not going to interview.
Right.
But most programs, their score is about probably 50, 55. Yeah. So that brings the question, okay, you scored 55, you scored 60. That doesn't guarantee you a place.
Right.
What guarantees you a place is the total package you present to that program.
Yes, and a score is just part of your candidacy. Yes. But I know the higher the score, the more your candidacy will be evaluated and looked at.
Yes, that's true. That's definitely true. That's definitely true. Yeah, I have seen people who got accepted based on the outcome of their interview.
Yeah.
They were the candidates that came up, borderline candidates. But on the day of interview, they were able to convince the panel on why they were a good candidate for that program.
Yeah.
Attitude is key to me.
Yeah.
Attitude is the number one. Are you a team player?
Yep.
Are you teachable?
Right.
Yeah. So in addition to having good scores, are you teachable? Are you as of 2 years ago, I think as of 2 years ago, there were people that actually had very good scores, like 70, that never matched.
So there you go, guys. You're getting some really good value. If you like what you've heard, hit the thumbs up down below. And if you're listening, just take these notes down and write a comment down below. Let us know what you like so far about what you've heard about surviving, but also getting into oral surgery programs as well. What about some tips for residents that are in oral surgery now? They're either in their first year or second year or even the third year, because like you said, it's going to be busy. So
yes, time management is number one. Time management, there's never going to be enough time in the day. Never, ever will there be enough time in the day. You need to understand the system your program runs in. Is your program purely a resident-driven program? Is your program is one in which the attendants and the program director primarily solely run that program? You need to understand your environment. You need to understand what the rest of your teammates are like. But personally, time management, studying, making time to study and study and study. And I would want to say, like, ask questions. Even for the chiefs, I say ask questions. Ask questions. Be open to learning. Be open to learning. Ask questions. Some people might have had experiences outside your current residency program, or maybe from your home country or something like that. So, but be open to learning new things or different ways of doing the same thing you already know. Don't be fastidious to you. Don't be fastidious in your ways. It's so common with residents. There's this thing about being fastidious in their ways. This is how I know it. This is how I've done it. And so I would close that door to any other suggestion anyone gives to me. That's not the goal of residency, is to learn. When you get a residency, you can now implement whatever clinical and academic knowledge you have acquired to provide quality care for that resident, for that patient. But while you're in residency, the goal is to learn, and you would have different attendants who have different approaches, who have different concepts. Some oral surgery attendants don't believe in opening condyle fractures, subcondylar fractures, or condylar head and neck fractures. But some attendants will open it. So you need to learn as much as possible from the different attendants, different schools of thought you have over there, and understand your teammates. Understand what your chief requires of you. Ask questions. Be open to communication. That's key in being a very good resident. I was always willing to say, okay, tell me what you want. I was always open to telling my chiefs and my senior residents, tell me what you want. This is what I know. I had a very good example. There was something called bicoronal flap outside, because the system in the US is different from the rest of the world. And I learned a little bit of oral surgery before coming to the United States. I just was a little bit exposed to oral surgery. So there were terminologies that were different from what is done in the United States. And I remember one of my chiefs was, as an intern, was saying something, and he asked me a question. I gave him an answer, and he was opposed to my answer. And I said, okay, this is it. Tell me what you want. And he told me what he wanted. And I went to go read it up. I found it was just a terminology difference. And that solved everything. Rather than like saying, no, I'm not going to listen to you. I listened to him, understood where he was coming from, went back, read it up, and found it was just mostly a semantic or terminology difference. And so my advice for most residents: communication, time planning, study, and be open to learning new things.
Gotcha. Well, I tell you, we've been open to learning all the tips and all the ways to survive oral surgery residency, and it's been very helpful. Again, guys, if you've gotten some value from this video, please make sure that you share it, and also like and give us a comment down below as well. Doc, what's the best way to get in contact with you if people have questions or want to talk to you some more?
Yeah, there's nothing, I'm not going to be like, oh, don't call me. My cell phone is 862-202-0460. Once again, 862-202-0460. Well, I prefer text messages, WhatsApp or regular text messages, a whole lot better. But if you're outside the United States, please do not send me regular text messages. My phone plan actually charges me when I receive international text messages. Send me WhatsApp messages.
WhatsApp. Okay, we got WhatsApp
messages. Email, you could reach me on my email address. My email address is nnamdi.anosike26@yahoo.com. I'm also on Facebook. You could find me on Facebook. You could find me on Instagram. My Instagram is, search me, Nnamdi Anosike or Nadolol, the beta blocker medication, Nadolol. I think Nadolol 01 is my Instagram information. So reach me out. I'm on social media, but just leave me a message. But remember, no regular text messages for those outside the United States. If you do that, I will block you because I get charged.
That's
unless you're sending me the money. For WhatsApp messages. Very good.
That's good. That's good. Hey, Doc, so future plans. You want to share with us things that you're thinking about doing?
Yeah, so I have to take everything into consideration, not just myself. I have a family, I have a wife and kids. I have to put them into planning for all that. My wife would kill me if I just made a plan alone, because she's been with me. She's been with me through this whole journey and everything. So I'm trying to strike a balance between my civilian life and military life. I love United States. I love the U.S. Army. I'm serving the U.S. Army, and I'm still going to be a reservist. And what does that mean? I could get called up for active duty at any time. I'll take it. But my main future plan is private practice, and further down along the line, a little bit of academics, a little bit of like teaching residents. Now, initially I was thinking I was going to go into like teaching, like maybe in a residency program, but I think I'm geared towards like teaching dental students the basics. I feel if you learn the basics of oral surgery, you'll be a very good dentist. So I slowly am thinking about like teaching in a dental school setting, maybe 1 or 2 days a week or something like that, or private practice, and combining this with my military career.
Sounds good. Sounds good. Dr. Oral Surgery Doctor Anosike. Man, thank you so much. Continued success for you. You guys check out these next videos right here. Hopefully they will help you in your pursuit of some of the topics that we've talked about. And that's our time, man. Love, peace.
Thank you so much.
And smiles. We'll see you guys on the next video.
Thanks. Bye.